Vaginal cancer. The aim of this short video is to provide useful information to women and their families with a suspected or confirmed vaginal cancer diagnosis. What is the vagina? The vagina is a muscular tube that extends from the opening of the womb or the cervix to the folds of skin between a woman's legs, also referred to as the vulva. It allows blood from your period or menstruation to drain out of the body. It's also the passageway which through babies are born. So what is vaginal cancer? Cancers that start in the vagina are called primary vaginal cancers, and these are very rare. There are fewer than 300 women diagnosed in the UK every year with this type of cancer. It's more common in ladies over the age of 60, but it can be seen in younger women. What are the symptoms of vaginal cancer? The most common symptoms of vaginal cancer are bleeding after the menopause, between periods or after sex. You may experience some blood-stained vaginal discharge. You may have pain when passing urine, or you may need to pass urine more often. Some ladies describe pain in the pelvic area and also feel the need to go to the loo more often to move their bowels. You may have some associated leg swelling too. So how is vaginal cancer diagnosed? If your doctor or nurse suspects an abnormality, then a biopsy may be taken from the affected area. This is usually under local anaesthetic. If this confirms the presence of a cancer, you will be referred to our Gynecology Oncology Centre, which is currently based at the Queen Elizabeth Hospital in Gateshead. Staging and grading of vaginal cancer. The stage of a cancer describes its size and whether it is spread beyond the area from where it started. The grade of the cancer gives an idea of how quickly the cancer may grow and spread. Knowing the stage and grade of your cancer will help your doctor decide on the most appropriate treatment. So are there any risk factors for developing vaginal cancer? The exact cause of vaginal cancer is unknown, but there are several risk factors that have been identified. For example, age. 70% of all vaginal cancers in the UK are diagnosed in women over the age of 60. The human papillomavirus, or HPV, is a group of viruses that spread due to skin-to-skin sexual contact. There are many different types of HPV, and most people are infected with the virus at some time during their lives. In most cases, the virus goes away without causing any harm and doesn't lead to any further problems. However, HPV is present in more than 2/3 of women with cancer of the vagina, which suggests that it may well increase your risk of developing the condition. Abnormal cells in the cervix or vagina. You're more likely to develop cancer of the vagina if you've previously been found to have abnormal cells in the cervix or the vagina. This may have been referred to as cervical interepithelial neoplasia, CIN, or vaginal interepithelial neoplasia, VAIN. CIN and VAIN are terms used to describe cells that are abnormal but are not different enough to be considered cancerous. Both are thought to be closely linked to having had a persistent HPV infection. What treatment is available? The treatment you have will depend on different factors. These may include the stage of your cancer, whereabout it is in the vagina, and your general health. The most common treatment for vaginal cancer is radiotherapy. It's often given alongside chemotherapy to treat vaginal cancer, and this is known as chemoradiation. The combination of treatment can be more effective than radiotherapy on its own. Surgery may be offered for very early stage cancers, which cannot be cured with radiotherapy alone. Additional information can be gained from the Macmillan website or via the Eve appeal. Your clinical nurse specialist, myself or Bernie Cardy, will remain your point of contact throughout your treatment and beyond.